All right, so today we'll be doing the assessment on the 12 cranial nerves. They will be subcategorized into 3 specific categories. 1, motor, which focuses on movement. 2, sensory, which focuses on sensation. And then 3, mix, which would be both. All right, so for all of these tests, a negative test means that there is no problem, and a positive test means that there is an issue. Okay, so we'll be assessing cranial nerve number 1. This is the olfactory nerve, and we will be assessing the sense of smell. Can you smell this?
Yes.
Okay, she can smell that, so that means the test is negative. Next, we will be assessing cranial nerve number 2, the optic nerve. This is a sensory nerve, and then I'll have you read the flavor of that Powerade behind you.
Strawberry lemonade.
Okay, she's able to see that and she's able to read it, therefore that is a good sign, and this is a negative test. This is for cranial nerve number 3, the oculomotor nerve. This is a motor nerve, as the name implies. We'll be taking a flashlight here and moving it closer to the pupil, and it should dilate as the flashlight becomes closer and closer to the eye. If it does not dilate, this will be a positive test. The pupil did dilate, so that is. Now we'll be assessing the cranial nerves 4 and 6, trochlear and abducens. Both of these are motor nerves. The trochlear nerve focuses more on the upward rolling of the eyes, and the abducens focuses on lateral eye movement. To assess this, I will have her track my finger with her eyes. If she is unable to track my finger with her eyes, that would result in a positive test. Next, we are assessing the cranial nerve number 5, the trigeminal nerve. This is a mixed nerve, meaning it plays a role in both motor and sensory. So for the motor, it is controlling of the mastication muscles, and the sensory is responsible for feeling in areas such as the nose, forehead, temple, scalp. To assess this, I will have her bite down on this fork. Okay, she is able to do that, so that results in a negative test. Next, we are assessing cranial nerve number 7. This is the facial nerve, and it is also a mixed nerve. Its motor function controls facial muscles, and the sensory portion of this nerve controls taste. To assess this, we'll ask her if she can do a pretty little smile and raise her eyebrows. Okay, she can do that, so that is a negative result for this test. We're now assessing cranial nerve number 8, vestibulocochlear nerve. This is a sensory nerve, and we will be assessing hearing and balance here in 2 different phases. First, I will snap on either side, and then she will raise her hand, okay, so she can hear on the correct side. And then to assess her balance, move this chair. Have her place one foot in front of the other. Close your eyes, hand on hips. And if she does not fall over, then that is a negative result. We are assessing cranial nerve number 9, the glossopharyngeal nerve. This is a mixed nerve. The motor function controls the pharyngeal muscles, and the sensory function allows for taste. To assess this, we'll ask the patient if she can swallow. Okay, good. That means that is a negative result. Next, we'll be assessing cranial nerve number 10, the vagus nerve. This is a mixed nerve as well. The motor function controls pharynx and larynx, and the sensory function controls the gag reflex. This was also tested with her ability to swallow, which she was able to demonstrate in the previous test. Cranial nerve number 11 is the accessory nerve. This is a motor nerve, and this controls the trapezius and the sternocleidomastoid muscles. To assess this, we'll ask her if she can shrug her shoulders. She can, so that is a result of a negative test. Lastly, we have cranial nerve number 12, the hypoglossal nerve. This is a motor nerve, and it controls tongue movement. To assess this, we will ask if the patient can move her tongue around. Stick it out and move it around. She is able to do so, so this is a negative test as well.